Hello, how are you?
I'm fine. How are you?
Can you tell me your name?
Ashley,
Today's date.
January 14th, 2018.
And who's currently president?
Obama.
She is alert and completely unoriented. So I'm gonna start by taking your vitals. I'm gonna start with taking your pulse, okay?
Okay.
Okay, great. Your pulse is a 72. And as I assess her pulse, I also assess her respirations, but you do not want to let the patient know that you are assessing their respirations as you are doing it. So I'm going to take her tympanic temperature. I'm going to clean this off because good nurses are clean nurses. And as I do this, I'm assessing for movement of the auricle and her tragus. I'm pulling her ear up and back because she's an adult. 98.6 degrees. Why don't you look at that? Next, I'm going to take your blood pressure. I'm going to locate her brachial pulse. Okay, great. Now I'm going to locate her radial pulse. Other body pulses include her carotid pulse, her dorsal pedis pulse, and her femoral pulse. But for blood pressure, we're just going to use these two. I'm going to align. Can you scoot up with your feet like that? Thank you. Thank you. Okay, great. It's very important that the cuff fits properly or you'll get a false reading. I'm going to assess her radial pulse. And I'm going to inflate the cuff until I can no longer feel it. And as I manually take her blood pressure, I'm going to place the diaphragm of my stethoscope over her brachial artery and listen for the first and last sound. Because I'm doing the two-step method, I'm going to inflate about 20 above where her pulse stopped. So I'm at about 140. And I'm going to listen here at the radial pulse for the first and last sound. Okay, your first sound was at 118 and your last sound was at 117. Can you pause it, please? So for this portion of the assessment, I'm going to assess her eyes by looking for symmetry in her eyebrows and in her eye coloring. I'm going to wear my gloves. And while we're doing the facial portion of the assessment, I'm also going to palpate her frontal and maxillary sinuses. Okay, so now I'm going to palpate your frontal and your maxillary sinuses. Please let me know if you feel any pain or discomfort. Any pain? Any pain? Great. Okay. Can you open your mouth and say ah? Don't she? Okay. Okay, those tonsils aren't kissing. I see that uvula. You're good. The mucosa is nice and pink as it should be. Pause. We are going to assess for her light reflexes. We also want to make sure that the light reflex is consensual. So first, okay. Okay, now if you could cover one eye, please. And focus. Now remove your hand. Okay, and your other eye. And remove your hand. Great. Next, I'm going to assess cranial nerves 3, 4, and 6 by doing the 6 cardinal field of gaze. So, okay. I want you to use your eyes to follow this pen and not move your head, please. Okay, great. And to assess cranial nerve 2, you could just read to me the front of that box.
Sterile alcohol pads, prep pads. Apply topical as needed. Discard after single use.
Great, cranial nerve 2 is working just fine. Well, I'm going to continue to assess the cranial nerves. Could you please close your eyes? Can you identify this odor? Is this a familiar odor?
Yes.
Can you please tell me what it is?
Alcohol.
And that is the assessment of cranial nerve 1. Pause. We're going to continue the assessment of the head, neck, and throat. We're going to assess her ears. I've already made sure that her auricle is movable and so is her tragus. Now I'm going to look at her canal and tympanic membrane. Because she's an adult, I'm moving her ear up and back. Pearly and gray. Next, I'm going to conduct the Weber test. Okay. I'm going to place this tuning fork in the middle of your head, and I'm going to need you to tell me if you hear the sound louder on either side. Okay.
Ahead.
Equally on both sides?
Mm-hmm.
Okay, great. Next, I'm going to do the Renee test. This test for air and bone conduction. Going to do bone.
Okay.
Okay. Air should be approximately 2 times longer than bone. If not, that is an abnormal finding. Pause.
Okay.
Now, I'm going to do the inspection of the nose. I'm going to look at her turbinates and her septum. Okay, everything is pink. Her septum is intact. Using inhalants, including cocaine, can often deteriorate your patient's septum.
That was only once in college.
And I've already palpated her frontal and maxillary sinus. So now we are going to move on to the assessment of her neck. So, Ashley, I'm going to palpate your thyroid by asking you to take a sip of water. Okay. Great job, Ashley. Can you shrug your shoulders? Thank you. That is for the assessment of cranial nerve 11. You pause it. Next, I'm going to palpate and auscultate her carotid artery. You can only do them one at a time because you do not want to obliterate the pulse. So, I'm going to assess your carotid artery, okay? Good, strong pulse. I'm also going to auscultate for bruit using the bell. Sounds really nice. I'm going to palpate her neck for tenderness. Let me know if you feel any tenderness, any pain. No? Can you lift your head back? Forward, to your left, to your right. I'm assessing her range of motion in her neck. Pause, please. If you could hunch over and round your shoulders, this makes the areas we're going to palpate more accessible when doing a lung examination. I'm going to assess for lung expansion. If you could take a deep breath, breathe in, breathe out for me. Okay, again. Okay, great, Ashley. Thank you. Now I'm going to assess for bronchophony by having my client repeat 99 as I also take from side to side down into the other side. Could you round your shoulders and lean forward? Thank you. And can you repeat the phrase 99?
99, 99, 99, 99, 99, 99, 99, 99.
Okay, great. Now I'm going to assess for tactile rheumatism. Could you resume the position? Thank you. I'm going to use two hands and have my patient repeat 99.
99, 99, 99, 99, 99.
Okay. Thank you. And pause. I'm now going to assess the alignment of her spine for any abnormalities. Okay, everything feels great. I'm also going to percuss her spine. If you could, thank you. Okay, great.
I just feel like everything's up there. I know what it is.
How many minutes am I at? We are going to begin the cardiac portion of our assessment. This assessment can be done with your patient laying supine. I am going to do something to her. Pause that video.
Go.
I previously stated the pulse points, so right now I'm going to palpate the maximum point of impulse, which is the apical pulse that is right here at the 5th intercostal space. Feels nice and strong. If I was gonna give her digoxin, she could have it. And now we're gonna also take the APEC M. Okay, so at her second left intercostal space is the aortic.
Mid-clavicular line.
Huh?
Y'all say mid-clavicular line?
Mid-clavicular
That's what we
line.
say.
At the left second intercostal space, mid-clavicular line is the pulmonic. Then we have, excuse me, I might have to review.
I'm first sitting up, honey.
You have Erb's point. You have the mitral, and at the 5th and last intercostal space, you have the tricuspid. So we're gonna also take those 5 places. If you could have a seat, please rise slowly for orthostatic hypotension. Rise slowly.
Okay.
Sorry, I'm probably saying that.
My blood pressure didn't indicate that. No, I think
Girl, you went to Jackson.
She didn't get you cancer, distraction.
I'm gonna check for capillary refill over 5 seconds. And refills in about 2 seconds. Okay. Okay. I'm gonna assess my client for edema on a bony prominence. No edema. Okay. Need to explain what the base and the apex are. The apex is where I palpated and auscultated. Down here. And thank you. And the base is up here. With the neurological exam, we've already assessed her cranial nerves. Right now, we're going to do graphesthesia and stereognosis. Close your eyes, please, and hold out your hand. Can you please identify what that object is?
It's a cat. The top?
Yes, it is. Okay. If you could please close your eyes and hold out your hand. Could you please identify what letter was written in your hand?
P.
Yes, it was. Next, I'm going to check your reflexes. Pause. So I'm going to test her muscle strength against resistance. Could you please try to push my hands down? Try to push my hands down.
Oh.
Good. And I'm gonna test her reflexes using this.
Nice.
Pause.
Mhm.
What? No. Why you hit me so hard? It hurt.
It's supposed to be like
This
right
is
here.
being recorded, Ashley.
Oh, did you record it? Oh, I'm sorry. I'm sorry. Go back. Oh, fine.
Pause. Could you please stand up? I'm going to assess your equilibrium by performing the Romberg test. On the count of 3, I'm gonna ask you to close your eyes, okay?
Okay.
1, 2, 3. Okay, you can open them. A small amount of swaying is natural. Anything abnormal should be reported to the physician because I'm just a nurse. You may have a seat. Now I'm going to palpate your head for any abnormalities. But I need to get my PPE first. Assessing for large amounts of dandruff, scabs, bumps, bruises, anything living. Any pain or tenderness?
No.
As I palpate your scalp.
Yeah, please, like, hold on, I got it. Yeah, thank you.
Pose. That is great. Now I'm going to perform the Homenton test, which tests for deep vein thrombosis. I am going to lift the client's leg against passive pressure and hold their calf and flex your foot forward for me. Any pain or tenderness?
No.
Great. Next, I'm going to inspect the abdomen. Looks great. When inspecting the abdomen, the next step is auscultation because you don't want to disturb the bowel signs by palpating or percussing. So I'm going to start in the right lower quadrant and assess for bowel signs. A little bit of origami. Can you tell me the last time you had a bowel movement?
About an hour ago.
Okay. And the last time you ate?
About 15 minutes ago.
Okay, great. Now we can palpate the abdomen in the same order, starting with the right lower quadrant. Any pain or tenderness?
No.
Next, I will percuss.
Heavy.
Some temper. She needs to eat.
That's jam because jelly
Pause.
she's like